Hello everyone, welcome to this presentation on IoT in Smart Health. Let's recall the last class topic. In last class, we discussed about the Internet of Things fundamentals and architecture, IoT definition and concept of IoT, and different layers of IoT architectures, IoT enabling technologies, characteristics and trends, and IoT specific protocols. In today's class, we are going to discuss about how IoT is transforming health with personal devices, then understand the Internet of Medical Things and essential sensor requirements. Next, we will discuss securing patient data, explore solutions for robust security, and finally simulate a heart rate monitor to see in IoT in action. The IoT is nothing but the Internet of Medical Things. The IoT market is rapidly expanding, expected to reach $187 billion by 2028. Wearable health devices such as revolutioning healthcare, they enable preventive care, chronic disease management, and remote monitoring. It will helping doctors to reach patients anywhere, anytime. It will reducing cost and improving access. Let's begin with the empathize stage of devices like the Apple Watch ECG have made a huge impact since 2018. With FDA clearance, it can detect arrhythmias and even identify atrial fibrillation in thousands of users. So, this makes a shift from reactive care to proactive health monitoring, where users take early action before problems occur. Now, let's define the concept. The Internet of Medical Things connects medical devices and healthcare IT systems through IoT technologies. It collects vital data such as heart rate, oxygen levels, and body temperature. It will enabling remote care, telemedicine, even in smart hospitals. Globally, the IoT is growing at a 28.9% compound annual rate, showing it is a massive potential one. In medical IoT, accuracy and reliability plays a vital role. And for example, ECG sensors operate in the range of 0.5 to 5 millivolt range, and the SpO2 ranges from plus or minus 2%. And the low latency under 50 milliseconds is vital for real-time alerts, and all data must be AES 256 encrypted one. For safety, finally, the system should ensure 99.9% uptime with robust error handling and for continuous monitoring. Now let's move on to the DT ideate stage. In the ideate stage, we brainstorm how to protect sensitive health data. Patient information, also known as PHI, it must remain secure and compliant with laws like HIPAA and GDPR. For instance, if data is sent over public Wi-Fi without encryption means it becomes highly vulnerable, so strong protection is essential. In strengthen the data security, we can use end-to-end encryption between device and cloud. So secure hardware modules for key storage, hardware modules and multi-factor authentication to control access. Regular penetration testing ensures vulnerable and quickly identified and fixed, maintaining patient trust and system reliability. Now let's move on to the prototype stage. We can simulate a wearable Internet of Medical Things device using a MAX 30100 or MAX 30102 pulse sensor with an ESP32 microcontroller. On Tinkercad circuits, we can virtually connect the setup to read pulse rate and oxygen saturation and display the results on a serial monitor 1. This simple prototype demonstrates how to enable real-time health monitoring. During next one is a testing stage. During testing, suppose we find a privacy flaw. For example, patient IDs transmitted in clear text through API calls. To fix this, we can use tokenization or pseudonymization and encrypt identifiers at the device level. This ensures and compliances with privacy regulations. Beyond ECG and SpO2, looking ahead, IOMT will expand beyond ECG and SpO2 sensors. It is, we can expect non-invasive glucose monitoring, real-time blood pressure tracking, and AI-powered predictive analytics for early diseases detection. Integration with electronic health records, that is EHR, will make healthcare more personalized and seamless one. To summarize, the Internet of Medical Things is revolutioning and healthcare delivery through accurate sensing, secure data handling, and intelligent analytics. IOMT ensures reliability and empowers patients to take control for their health. With ongoing innovations, the future promises a world where healthcare is smart, connected, and proactive one. So in IoT, let's move on to the mind map of this topic. In this topic, we saw that wearable IOMT for smart health. It includes the IOMT definition and scope, essential sensor requirements, prototyping and simulation, data security and compliances. Now let's test the wearable health devices are used to monitor DASH. It is used to monitor the heart rate, SpO2 and activity levels. The next one is IOMT stands for. The IOMT is nothing but it is an Internet of Medical Things. Thank you.